You might have heard of the Indian COVID strain, but is it something to be worried about? What's happening in India? There has been a huge spike in coronavirus cases in India. It's been reporting more than 200,000 cases every day since the 15th of April. The situation has led to the UK government adding India to the UK's red travel list, meaning Brits who have been there in the past 10 days must quarantine in a hotel for 10 days, and anyone who has been in India and who doesn't live in the UK will be banned from entering. Boris Johnson has also cancelled a trade trip to India planned for later this month. India is battling a new variant labelled B1617, which could be part of the rising COVID cases, and 182 cases of that COVID strain have been found in the UK. 162 of those cases were found in the 5 weeks up to the 16th of April.
It's worrying, first of all, that it is rising week on week, actually day on day within the UK. We don't know why this is, whether it's because these increases in numbers are linked to new cases identified through travel, or whether it's sort of becoming established in the community.
Viruses constantly change through mutation, and scientists always expected this to happen with COVID. Some variants will emerge and then disappear, while others persist and can have worrying mutations, like the Brazilian, South African and Kent strands, which all have a mutation which means they can spread more easily. So what do we know about this new variant?
This is a variant that's been identified in India and has become widespread and dominant very rapidly over a period of a few weeks. The places where the variant was noted to be more prominent initially are the places where we started seeing surges early on. The second reason of concern is that this carries two mutations that are particularly concerning. One mutation is a mutation that's in the same position as the one in the so-called South Africa and so-called Manaus variants that's been associated with a degree of vaccine escape and reduced vaccine effectiveness.
So will vaccines work against this new strain? It's too early to say whether the Indian variant will evade the vaccines, although experts say the current range of vaccines in use should offer some protection against variants, like Pfizer, which has published research suggesting its jab could offer good protection against the Brazilian and South African variants.
Vaccines alone cannot really prevent virus adaptation. In order to prevent virus adaptation, we really need to contain transmission with strict public health measures alongside vaccination. Vaccines do impact transmission, but they only do that once more than the majority of the population is vaccinated.
Could the new strain impact the lifting of COVID restrictions?
We're not in a completely safe place yet. People often say to me, why are you such a party pooper? We've had the vaccine. If you have faith in the vaccine, why are you telling us to be careful? So the reason I'm telling people to be careful is because I'm an immunologist and we have studied it in great detail. And if you've got a country where 50% have had one vaccine dose, many have had no vaccine doses, a very small number have had 2 vaccine doses, a very small proportion of those people would actually have protection against some of the nastier variants if they really took hold in this country, be it Brazil or South Africa or Indian variants. So we're really not in a safe place yet. So if they take hold, form a cluster, we don't quite get at them through our track and trace and our surge testing, then we shall lead ourselves straight back into trouble.
At the moment, UK health officials are investigating whether the new variant spreads more easily and if it's able to resist the vaccine. But adding India to the red list aims to stop more cases arriving in the country and spreading.